Overnight, California surpassed 500,000 coronavirus cases, becoming the first state to do so. And there are nearly 4.6 million cases now here in the U.S., with more than 154,000 deaths. We want to bring in Dr. Ezekiel Emanuel. He is a former Obama White House health policy advisor who is now advising Joe Biden's presidential campaign. He's also the author of the book, Which Country Has the World's Best Health Care? Dr. Ezekiel Emanuel. Good morning, Zeke. Appreciate your being here. Let's start big picture, if we can, very quickly. Is the situation getting any better nationally? And what should those states that the White House identifies as being at risk, potential hotspots where they fear they could be the next California or Florida, be doing right now?
Well, we are progressing, and we don't seem to be slowing down. We have, 60, 70,000 cases every day. We have an increase in deaths. That is not a good sign. At the peak in April, we were having 30,000 cases. So we are actually doing worse. The states, they have to impose the public health measures, social distancing, face mask wearing, hand hygiene, and closing non-essential businesses, not having indoor businesses like bars, beauty salon, tattoo parlors, and gyms. That's what you have to do. We know this. We can see it from other countries that have been successful at bringing their cases not quite to zero, but very, very low.
Dr. Emanuel, let's talk about the other big issue, which is, of course, testing. We are doing more testing now, nearly 1 million tests per day, but a lot of the results are not coming in fast enough. People having to wait days or even longer than a week to get those results. Everyone, even the president, says we need to do better on this. So what specifically needs to happen in order for there to be more quick tests all across the country?
You need competent leadership and coordination. The president gave this to Jared Kushner and Admiral Giroir in mid-March. We are now nearly 5 months later, and we still don't have adequate testing. That is incompetence. You need a supply chain. You also need to tell the testing companies that they need to beef up their activities. They wanted these tests. They're getting paid very handsomely, $100 a test. If they can't give results in 48 hours, maybe we shouldn't pay for them. That idea has been suggested by a group from Duke, and I think it's quite reasonable. If the test isn't medically useful, why are we paying so much money for it? We also need to accelerate the development of those home testing kits, point-of-care testing kits. All of this should have been done, and, Jared Kushner and Admiral Giroir have not stepped up to the job. This is not very good leadership.
Yeah, Dr. Emanuel, can you give us a sort of a reality check on vaccines right now? Obviously, there's reason for optimism. We know that those trials are progressing, real hope that there may be progress before the end of this calendar year. But how much stock should we be putting in a vaccine, sort of putting an end to this? And what challenges still lie ahead on that?
Yeah, so we have six vaccines in what's called phase 3 trials. That's the effectiveness, the final phase trials. I think Dr. Fauci is right. By early next year, we'll have very important results, whether they work or not, and which ones of them work. But there are still two big issues once you have a vaccine proven. One is, how long is it good for? A vaccine that lasts only 3 months is not very effective. We need one that really lasts at least a year. And then there's the big challenge of actually going from producing the vaccine to putting shots in arms of 300 million Americans. And some of these vaccines require 2 doses, which requires 600 million shots inside of a couple of months. I don't think that's logistically possible. And again, this administration has not shown itself capable of managing these kind of complex issues. They just don't have the competence to do it. And there are many, many barriers, potentially. Glass vials to put the drugs in. You need actually to fill them and put them in the glass vials in super sterile conditions, ship them out, and get people to vaccinate. Just imagine 300 million vaccines. You need 1 million people working almost a whole month. It's a very, very big challenge.
Well, the whole country is united in one thing, hoping they get that vaccine soon. Dr. Ezekiel Emanuel, thank you very much for waking up with us on a Saturday.
Really appreciate it.
Thank you. Good to be here.